Okay, so my name is Henry Scholes, and this is
Matt Jordanelli.
and we're both finishing up the sports residency this month here at Howard Head Sports Medicine.
I think the mentorship here is really one of the biggest and most important aspects of the program. Like you said, we have individuals that have tons of experience, tons of knowledge, but they also just care so much. Thomas especially puts in so much work for the program so that our lives are easier and makes his life a heck of a lot harder, but we really appreciate it. But just the time that they take to make sure that all of our questions are answered, to make sure that we have the difficult discussions that are really going to make us better PTs. And sometimes they're not easy discussions. They ask difficult questions that really challenge us to think about the hard details about individual patient, or to kind of assess and validate a research article and say, really, why are we using this technique, or why are we thinking about treating a patient in this way? They make sure that they ask those difficult questions and have those hard conversations to make sure that we're really ready for any situation, and we've really thoroughly evaluated the research to say, like, I want to use these certain aspects of physical therapy treatment with this certain patient and patient population, down to these treatments work better with a younger versus older population versus males and females, down to those types of details. So we're really confident in what we're doing.
So in terms of different residency programs, specifically the Howard Head program is unique in that it has a relationship with the U.S. ski and snowboard teams. We get some unique opportunities, and then we get to travel to Gunderson to work with their residency program. We get to work with some of the best surgeons in the world at the Stedman Clinic, and I think that is some of the initial allure to the program, and has definitely been highlights. But just as Matt was touching on, I can't agree more that the best aspect of the program has been able to interact with some of these veteran therapists. So spending a 40-minute session or 80-minute session with a patient, and you're working one-on-one with them, treating them, you're using all the knowledge you had in PT school, that you got in the didactic lectures here, that you had from other mentoring sessions, and then you sit down with your mentor afterwards and you comb through all of that. So you talk about what went well, what you can improve on, what your clinical reasoning was, and after you go through all of that, then that mentor of yours will then teach you techniques, give you additional things you can work on to really help to foster and develop those skills. Yeah, and I can't thank you guys enough for this opportunity, and I'm almost without words in how this. I can't reflect enough in that I can't imagine not having this experience as part of my life, and part of developing as an individual as well as a therapist. So thank you very much.
Yeah, I second that, and we want you to know too that your contributions and your help with the program here really make our lives that much easier. It takes some of the stress off as residents with productivity and some of the other things, so we can focus on working with the mentors and the other therapists to really get the best education that we can out of this year-long experience, and we definitely couldn't do that without you guys. So thank you very much.